We're here to talk about the major differences between men and women when it comes to heart disease. Joining me is Dr. Frederick Shaliff, an interventional cardiologist at Cardiology Consultants of West Broward. Welcome to the show, Doctor.
Thank you, Derek. Pleasure to be here today.
Thank you, sir. Dr. Shaliff, let's go right into it. Is there really a big difference in heart disease when it comes to men and women?
This is a very good question. What we find is that the underlying process is the same for both men and women. But the major difference here is that women sometimes present differently than men. So when they come to the office, their symptoms are a little bit different, and sometimes physicians don't always pick up on that right away.
Because the word heart disease covers a lot of different heart problems.
Yes, yes. And we talk about it sometimes in general terms. When we talk about heart disease, we think a lot about blockages and heart attack. But there are other issues too. Valvular heart disease, mitral valve, aortic valve, mitral valve prolapse, heart failure, all those come under the same title as heart disease.
Is heart disease the biggest killer for men and women?
Yes. As a matter of fact, roughly between 800,000 to almost 1 million people will die a year of heart disease. And it is the #1 cause of death for both men and women. As a matter of fact, for women, there's more deaths from heart disease, cardiovascular disease, than cancer.
How come they don't take this more seriously, if that's the case?
Yeah, and you would think they would. Sometimes it's awareness. But sometimes you have to realize there's so many factors that go into heart disease that sometimes they don't think about it. And sometimes the symptoms are so vague that they don't really, or they think it's something else. It's not really their heart. For example, shortness of breath, fatigue, back pain. These are symptoms that are more common in women than men, but may actually indicate there's something going on for blockages with respect to their heart. But they don't think about it.
So these little things you just talked about, they build up little by little, so it's not really something like one day to the next. So they might not really notice before it's too late, until it's too late.
Exactly. It's a very, very slow, long process. If you have diabetes, if you have high blood pressure, high cholesterol, overweight, you don't exercise, these are gradual things that affect the process where you build up these blockages over time, sometimes many years. And then when it gets to a certain point, then they have that event. And that's when they realize, oh, there's something wrong.
So how long does it, you said many years, is it a typical amount of years, or is it different for every person?
Yes, it's very different because it depends what's driving the process.
Okay.
If it's blood pressure, how well your blood pressure is controlled. If you have diabetes, how well your sugar is controlled. Do you smoke? How much do you smoke? How long you've been smoking? Are you overweight? Are there any genetics that come into play? Family history. All these things, and if one is more prominent than the other, it may facilitate the onset more quickly.
Talking about prominent, is there something in women that is more prominent than in men when it comes to heart disease?
Well, a little bit, but women are somewhat protected because of their hormones. So the onset of the heart disease is usually about 10 years later. And we see that. It's not till after menopause does the process become accelerated. So there is a little bit different there with respect to the physiology of a woman as opposed to a man. But once the process starts, it's the same for both.
What should a husband or boyfriend be, what kind of symptoms should they be looking out for in a woman, for example?
Well, generally there is some commonality between men and women. The chest pain, the pressure, sometimes it goes up to the jaw. They get pressure when they walk, and then when they slow down, they feel better. But women, as we mentioned, their symptoms are sometimes more unusual than men. The fatigue, the shortness of breath, and the back pain. We see that a lot with women more so than men.
Not just when they're pregnant, but even when they're not pregnant, they have back pain. And that's a good sign. That's a good sign to look out for out there.
Now, it doesn't mean everybody with back pain has a heart problem, but you should tell your doctor, especially if you have risk factors.
And for example, if somebody who works out and they work out their back and they know their back is in good shape and they're having lower back pains all of a sudden, maybe that's a good indication that perhaps they should see a cardiologist.
And you know, you have that onset of fatigue, tiredness, nausea, indigestion. I remember seeing one patient in the hospital one time, they thought she had a stomach virus. And lo and behold, they found it was a heart attack. And it just didn't appear that way, but that's how sometimes they present, more so in women than men.
Can you just recap again what you spoke about, the things to really kind of look out for and how to avoid possible heart diseases? I know it's a gradual process, but is there anything that you could...
So we look at prevention, primary prevention. We look at the risk factors. We look at your blood pressure, your heart rate, your weight, how much you exercise. Do you smoke? Is there a family history? And then we try to control those. Those we can control. The genetics, we're not there yet. That's something that's from your parents that may or may not evolve or show clinically. So we do everything we can treat, and then of course you have to speak to your doctor. You've got to communicate your symptoms. If you don't, then the doctor may not pick up on it. And sometimes you just think something is vague, like a woman will come in with back pain. Well, to her, maybe she was lifting groceries or whatever, or going to the gym. But a physician, when he puts all this together, the whole picture, he may say, well, you know what? I think we need to do a stress test or a CT scan, or just look into it a little bit more.
So you would just recommend, if there's anything, if you're in doubt, go talk to your doctor?
Yes, and you know your risk factors. Most people know. They're smoking, they're not exercising, they may have walked into a drugstore and checked their blood pressure, was a little bit high. Sometimes they ignore these things.
Okay, and they ignore it maybe because they just don't want to face the reality that they may have a problem.
That is true.
I hope that doesn't happen very often. Dr. Shalev, thank you for joining us on the Spotlight today.
Pleasure.
Great information. Thank you.
Excellent. Thank you.